Hi. Most of us might have seen the movie Thakur in Telugu or Gabbar in Hindi, where a patient who was declared dead in a government hospital is taken to private hospital and the doctor admits the patient in ICU, connects to ventilator, gives fake treatment and charges in lakhs. Is it really possible that this kind of thing can happen in a hospital? Let's see. Before we get on with discussing if it is really possible or not, let's first define death.
For medical legal reasons, death is classified into two types. First one is the somatic or cardiovascular death, and the second one is the brain death. In this video, I will be referring to the cardiovascular death, and we shall discuss brain death in the next video.
In medical and legal terms, death is defined as irreversible cessation or stoppage of circulatory and respiratory function. That means the heart has stopped permanently and cannot be restarted, that even CPR cannot restart the heart, and breathing also has stopped. So if a patient has no heart rate, no respiration and a flat wave on ECG, then this person is termed as dead, and then only technically a death certificate can be given to the patient. Let's suppose this patient who is given a death certificate is taken to a private hospital. Upon reaching the emergency, the first thing any doctor does is checks the vitals. And because the patient is dead, he will not have a pulse rate, he will not have a BP, he will not have respiration, and his ECG is flat. So no matter what kind of treatment is given, CPR is given, connecting to a ventilator is done, or whatever is done, because the patient is dead, it will always show flat lines and everything is not recordable readings. And suppose if it shows some kind of reading on CPR, then it means that the patient was not really dead in the first hospital, because as per the definition, it is irreversible cessation of circulatory and respiratory functions. If CPR can restart the heart or restart the respiration, then it was not death in the first place. Now coming to the first question, can a dead person be admitted in a hospital given fake treatment? Yes, that is possible. Suppose you admitted the patient in the emergency and there you did not notice what the readings on the monitor were and what treatment was given, and before you could notice, patient was shifted to the ICU. To show some kind of reading, the wires of the monitor may be connected to someone else. The hospital can make you believe that your patient is alive and give treatment to him and charge you in lakhs. And how to protect from this kind of fake treatments is, whenever you take your patient to the emergency, please have a note what are the readings on the monitors. And when your patient is in ICU, please try to notice if the wires of your patient are connected to the same monitor or not. The main thing to understand here is, if the monitor shows any kind of readings, your patient is alive.